Welcome to Pinoy Medical Coder. Today, we'll discuss about diagnosis-related group, DRG by nobility. Before we begin, please don't forget to like our Facebook page and like and subscribe to our YouTube channel. What is diagnosis-related group? DRGs are assigned by a group or program which gathers claim information based on ICD diagnoses, procedures, age, sex, discharge status and the presence of complications or comorbidities. All these factors are used to determine the appropriate DRG on a case-by-case basis. History of DRG. DRG was first developed at Yale University in 1975 for the purpose of grouping together patients with similar treatments and conditions for comparative studies. Later on, October 1, 1983, DRG was adopted by Medicare, National Health Insurance Program in U.S., for regulating the cost of inpatient hospital services. Today, almost every healthcare sector adopted DRG to reduce hospital costs. What is the purpose of grouping together patients with similar conditions? Grouping is done to follow standardized system of payment for similar conditions as a measure to avoid unnecessary additional treatments as well as long duration of stays in the hospital for the purpose of getting additional money. Earlier hospitals will charge for each day of inpatient services, thereby increasing the expenses. In an attempt to bring down the cost, the government sought a way which is DRG, a tool which groups together conditions and fixing a standardized payment, thereby also improving the quality of services rendered to the patient. Let us look from a practical perspective. Most of us love burgers. The craze and appetite for burgers never end. Weekends are often spent in strolling in malls with frequent visits to food court. 90% of the population go for burgers as it is a budget-friendly meal, enhancing the taste buds. Usually, we end up buying a super mega deal burger combo which is inclusive of fries and soft drinks. None of us will pay additionally for these extra stuffs, fries and soft drinks, since it's a part of the package as well as it is quite expensive. Similarly, DRG is a bundled combo package which is inclusive of all the resources, treatments and all the care and efforts taken for that particular visit and nothing paid separately. We can proudly credit DRG as an angel in disguise. How does DRG enhance the quality? DRG grouping has already fixed the number of days for each illness considering the patient's complications, secondary disease or conditions aggravating the already existing one, and comorbidities, pre-existing condition co-occurring with the primary condition. In some cases, patients may get discharged earlier than the fixed number of days. However, if the patient is readmitted again for the same condition, this, in general, is considered as the hospital's accountability. This will ensure that the quality of healthcare will considerably improve at an affordable cost. Let us look into an example for better understanding. Patient John and Mark were both admitted with similar illness pneumonia and specified in Hospital A and Hospital B respectively. Hospital A discharged John after 2 days whereas Hospital B discharged Mark after 1 week. The question would be asked, what was the reason of Mark's extended length of stay? If the illness were the same. Moreover, the extended stay would consume more resources for the hospital and high bills for the patient or insurance. What do we infer from these two cases? In John's case it was early discharge where Hospital A utilized resources moderately, so the hospital has nothing to lose, financially biased, but from Mark's case, it is evident that the Hospital B overutilized the resources. This would be obvious in DRG billing as ICD is the basis of DRG billing. In other cases of billing like fee-for-service, the CPTs would be billed where one would not be able to evaluate the case on the basis of case or diagnosis. That's the advantage of DRG. The best part in DRG is, it paves a way for win-win situation where both the provider as well as the payer is mutually benefited like the symbiotic relationship. It is a win-win situation, the best of both worlds. DRG classification. DRG has two main classifications. Medicare Severity, MS-DRG. Internationally Refined, IR-DRG. Let us look at a brief introduction of International Refined Diagnosis Related Groups, IR-DRG. International Refined Diagnosis Related Groups, IR-DRG. IR-DRG classification was designed to adapt to different countries and different healthcare settings. It's a collaborative effort between three MHIS experts and professionals from different healthcare systems. The algorithm discriminates in patient and ambulatory encounters while enabling consistent grouping of cases with similar resource consumption. Dimensions of IR-DRG classification. The type of acute care patients treated in a healthcare system, that is, its case mix. The resource spent incurred by the provider to deliver care. A notion of quality in regard to the encounter, a measure of the risk of dying called the risk of mortality. Significance of DRG. To enhance the quality of care of the patient by capturing the accurate severity of illness, risk of mortality, length of stays, resources utilized, RW, and ensure the appropriate reimbursements for the hospitals as per the level of care provided. The following are the areas impacted by the DRG classification reporting: management, budgeting, payment, profiling, benchmarking, clinical research, quality reporting. Characteristics of DRGs. Their cost homogeneous thus defines similar patterns of resource use. Patients in a DRG are not identical. Predict the average level of resource use. Clinically coherent with similar clinical characteristics. Common organ system, etiology or clinical specialty. Mutually exclusive. 1 DRG equals 1 patient stay. Structure of IR-DRG code. The 6-digit numeric code where each digit defines the Major Diagnostic Categories, MDC, type, DRG and severity of illness. The 7th digit representing the risk of mortality is optional. What does the DRG cost cover? DRG payment include physician care, nursing care, technician services, therapies, radiology, laboratory, pharmaceuticals, rooms, meals, etc. Example of IR-DRG classification based on DRG formula. DRG 041301 without CC, relative weight, 1.7415, IP moderately complex respiratory system procedures without CC. DRG 041302 with CC, RW, 2.6288, IP moderately complex respiratory system procedures with CC. DRG 041302 with MCC, RW 5.6331, IP moderately complex respiratory system procedures with MCC. Role of clinical documentation in DRG reporting. Specific, precise, accurate, consistent, reliable and complete clinical documentation ensure the accurate capturing of the patient SOI, severity of illness, ROM, risk of mortality, and ALOS, average length of stay, so that the hospitals can report the appropriate level of care. This will overall result in improved patient quality of care. Improve quality of care by correctly capturing the patient SOI, ROM and ALOS, so that the hospitals can report the appropriate level of care. Standardize medical data for research and to track analysis. Improve the case mix index of the hospitals. Minimize claims rejections by the insurance. Provide suitable hospital reimbursements for the level of care they provide. correctly maximize the DRG assignment and optimize payments for the services rendered to the patient. Serve as legal defense when necessary. DRGs as hospital case mix measurement. DRGs are a way of measuring the case mix or relative severity of illness and cost of the different types of inpatient stays or products provided by a hospital. DRGs adjust hospital prices and payments by measuring the case mix of patients treated by a hospital. DRGs can group together different kinds of patients, including clinically similar ICD-10 diagnosis codes, as long as they are also similar in cost or hospital resource used. DRGs enable hospitals to be paid more only if they treat severe cases or patients, more severely ill case mix of patients, rather than being paid more due to the reputation or name of the hospital. Some DRG systems, including IR-DRGs, further subclassify hospital stays by the severity of the patient's illness. Conclusion. If you feel you have learned completely about DRG from this article, maybe you are wrong. Healthcare billing is an ocean where DRG billing is the new wave. To actually work on DRGs every day, you need to know the principles of DRG, structure of DRG, DRG calculation formula, steps in using software for DRG calculation or computation, few tips for applying DRG in daily coding from experts, DRG case mix index and its impact on revenue, common errors in DRG coding, and review few DRG case studies. For more information, please check the reference below. Thank you for watching.